everybody, I'm Victoria, a product and risk assessment expert specializing in women's health. As you know, adnexal masses are an extremely common gynecological diagnosis. While most of these masses are benign, accurately assessing the risk of ovarian cancer is crucial to both you and your patient. As you know, Aspira's OvaSuite portfolio can help you with precise risk assessment of an adnexal mass. While both OvaWatch and Ova1 are precise, non-invasive blood tests for ovarian cancer risk assessment, how do they differ? First, we'll talk about OvaWatch, a risk assessment test for adnexal masses, evaluated by initial clinical assessment as either indeterminate or benign, with a negative predictive value of more than 99%. But what does all of that mean? OvaWatch is designed for the patient that is not headed straight to surgery. Maybe the mass looks benign, maybe the pathology isn't clear, but you and the patient would rather avoid surgery due to complications such as pelvic adhesions, or maybe you just don't know if you're going to surgery yet. Because OvaWatch is intended for the patient with a mass that is not going to surgery right away, we designed it to answer one of the most important questions on your mind in that clinical situation, which is how confident can I be that this mass is unlikely to be cancer? To answer that question, you need a test with an extremely high negative predictive value. OvaWatch is optimized for negative predictive value in this lower risk watch and wait type population. And the data shows how effective this test could be. In a recent study published in Frontiers, a retrospective review of 785 women across 12 different centers showed that using OvaWatch for malignancy risk surgical triaging could have reduced surgeries by up to 62% overall, with a potential 59% and 77% reduction among asymptomatic patients and premenopausal patients, respectively. With its new longitudinal monitoring feature, OvaWatch can help you provide ongoing, confidence-inspiring risk assessment through your patient's ovarian health journey. But what about those patients you know need to go to surgery, either because of how the mass looks, their symptoms, or even their worries? This is where Ova1 comes in. We designed Ova1 to help answer the question you are likely thinking about at that moment, which is, can I do this surgery? Or should I refer this patient to a gynecologic oncologist? To answer this question, it's most important that you have a test with a high sensitivity. Ova1 has demonstrated a sensitivity of 96% when combined with clinical assessment, and it accurately identified 59% of ovarian cancer risk that was missed by CA-125 alone. The objective risk score from Ova1 means added assurance to help stratify risk and personalize a patient's care by either confidently operating on them yourself, having a gyn-onc on standby, or referring them to a gyn-onc for more specialized care. So for personalized ovarian cancer risk evaluation and precise risk assessment, trust the powerful combination of Ova1 and OvaWatch from Aspira Women's Health to manage any adnexal mass in your adult patients. To learn more about our OvaSuite portfolio, please go to www.aspirawh.com. Thank you for joining me today. Together, we can realize the goal of making decisions based on facts and not fear.